An article written in 2024 titled Virtual Healthcare Revolution: Understanding Nurse Competencies and Roles discusses 12 different key competencies and skills that are needed for a virtual nursing program to succeed. On our side, you will see all of the key competencies discussed, and we will talk through a handful of them in more depth. One of the most important competencies that a virtual nurse must have is the ability to handle and navigate digital technology. The virtual nurse role is unique in that it typically occurs with the nurse sitting off of the unit in a general command center. The nurse is required to use technology to stream into patient rooms to support patient monitoring and patient education. Another area of focus when hiring a virtual nurse is ensuring that they are an expert in clinical decision making. As a virtual nurse, there are many areas of clinical support that can be provided, including help with admissions, discharges, and patient education. On top of that, Kathleen Sanford brings up the concept that these virtual nurses are also able to mentor and support new-to-practice nurses. This added layer of support for new-to-practice nurses allows moments of short staffing to feel more manageable. Care coordination is of the utmost importance for virtual nurses. Virtual nurses can be responsible for caring for a full patient assignment, and they must do so while coordinating care similarly to how a bedside nurse would. In addition, the virtual nurse is able to help with time-sensitive work that is not always able to be prioritized by the bedside nurse, such as admission paperwork, discharge paperwork, and central line education. As the virtual nurse helps with these different components of care, it is important to ensure that the nurse is also aware and capable of documenting appropriately. Professionalism and teamwork is also a major component of virtual nursing and an expectation that is upheld for virtual nurses. Without teamwork and professionalism, along with effective communication, these programs do not work. Virtual nurses and bedside nurses must communicate effectively and in a professional manner to ensure that the job can be done correctly and that all roles are respecting each other. Lastly, I want to touch on the importance of patient-centered care as a key competency. At the end of the day, our patients and their families are our main priority. In a virtual nursing environment, it is equally important that the virtual nurse be professional and portray the mission and vision of the hospital, despite not being directly at the bedside. Virtual nurses have the ability to improve the patient-family experience, as it may be faster and more efficient to relay information to a virtual nurse, opposed to having to wait for a physical bedside nurse. This is an exciting phenomenon and one that I think is very important to remember when hiring into this role.